When it gets to the genetics, I have a lot of frustration here
Mhm,
because, as you point out in the book, you have a whole chapter about, it could be your father because a lot of men are carrying BRCA genes,
mhm,
particularly BRCA2 can send, it might not have shown up as breast cancer, but it showed up for them. And it could
mhm,
be cancer, it could be pancreatic cancer. So we don't screen, we don't get just the pathogenic genes like BRCAs and others, but we also don't get polygenic risk scores. And so some medical centers around the country, like Mass General Brigham, are offering their patients, and for the common cancers like breast
mhm,
and others, also for heart disease, they're
mhm.
offering, this is a SNP chip. This is a cheap
Yes,
test. It's looking at 1 million variants of the genome. So it's not a sequence, which also could be relatively inexpensive. And we're not using these so that, for example, if you go back to the alcohol, or as we're going to talk about hormone replacement therapy or birth control pills, the people are just being treated all the same and they're
that's
not getting their genetic um, characterization either by a SNP chip, a simple polygenic risk score for breast cancer, or the idea of getting sequencing, especially when there's cancer running in the family, especially since it may not be the mother. Is a classic case, or the aunt, or whatever. So, can you comment about the underuse of
sure.
genetics?
Yeah, I think I let me first say the underuse of standardized genetic testing, which is really true. Look, um, there are a number of genes where if you have a mutation, there is a quantifiable increased risk of getting breast cancer. You bring up the BRCA genes are the most well known. 'Cause we've known about them since 19 and those genes are the ones that if you have a mutation, which you can inherit from either a mother or a father, you have the highest quantifiable risk of getting breast cancer. Your risk of getting breast cancer is 60 to 80%. There's also, as you pointed out, Eric, other cancers that can affect both women and men that are associated with those genes. Ovarian in women, prostate in men, pancreatic in both, melanoma, male breast cancer, etc.